Mike Schreiner, leader, Ontario Green Party. Mike Schreiner is the leader of the Green Party of Ontario and the MPP for Guelph. Elected in 2018, Mike was the first ever Green MPP elected to the Ontario Legislature. Very good. Mike was elected leader of the Green Party of Ontario on November 14, 2009. For close to a decade, Mike has been a leader in Ontario politics, being a champion on issues such as campaign finance reform, as well as advocating for the Guelph community on matters such as protecting Guelph's drinking water from local quarries. He has led successful policy campaigns to push the provincial government to fund the experimental lake area, protect local food supplies by restricting the use of neonicotinoid pesticides, support small business by increasing market access for local craft breweries, and fighting climate change by putting a price on carbon pollution. Mike's wife Sandy and their 2 daughters are active, spending their free time gardening, hiking, fishing, cycling, and volunteering in community activities such as the Guelph Rotary Tree Planting, Hillside Music Festival, the Guelph Jazz Festival, the Guelph Community Cleanup, the Guelph Coalition for Active Transport, and Democracy Guelph, amongst many other things. Welcome, Mike.
Thank you so much. Great to see you. Well, thanks for that kind introduction. I wish they would make them shorter, actually. But thank you for that. And I just want to say what an honor it is to be with you. And I want to take a moment to just express my gratitude for the opportunity to meet on the traditional territory of the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and on the treaty lands of the Mississaugas of the Credit First Nation. And I want to reaffirm the Ontario Green Party's commitment to the truth and reconciliation process. And I want to highlight the RNAO's commitment to diversity, equity, and inclusion. And I want to thank you for that commitment. Yeah, please give yourself a pat on the back. I love the opportunity to speak with RNAO, and I always look forward to this day. Though you confused me today because I walked to Hart House, and then I realized I had to come over here to Trinity, so you're changing things up on me. I want to thank Dr. Claudette Holloway for just the fantastic work you've done as president. Doris as CEO for RNAO. I tell everybody at Queen's Park, Doris is literally a force of nature. And I also want to congratulate and just say to President-elect Lamo Dolkar how much I've enjoyed working with you in the past and really looking forward to working with you in your new role as president. I want to offer my congratulations to each and every one of you for the work you did to defeat Bill 124. You deserve all the credit. And I can tell you what, as a politician, I was pretty honored and grateful to have the privilege of amplifying your voice at Queen's Park and in the media and giving Doug Ford hell in the 2022 leaders debate, if you'll recall. But it was you. It was the work that all of you did to defeat Bill 124. We knew that bill was wrong from the day it was introduced. It's led to longer wait times, more frequent ER closures, more expensive private nursing agencies, and more stress and burnout for Ontario's nurses and frontline healthcare workers. We knew the bill was unfair and unconstitutional from day one. And now that it's been repealed, the Premier has some significant work to do to repair the damage. And that work starts with the Premier issuing each and every nurse in this province an apology for the disrespect his government showed nurses in Ontario. And I'm committed to working with you to pushing the Premier for also undoing the damage by increasing your wages and creating better working conditions for nurses and frontline healthcare workers across Ontario. This was an important win, and I'm grateful for the work that you did. But I want to tell you, there is another bigger fight ahead of us, because this government is still plowing ahead with its ill-conceived plans to further privatize Ontario's public health care system. And I want to be clear. I want to be very clear today. The Ontario Greens stand with you and will work with you and for you to push back against this privatization agenda. Our health dollars should be focused on patient care, not shareholder profits. Our healthcare system was built by the people of Ontario, for the people of Ontario, not shareholder profits. Our healthcare system, I'll just use my outdoor voice. Our healthcare system, as each and every one of you knows, is in crisis. A crisis that's been building for years under multiple governments. But it's reached a breaking point. We know that putting pressure on you is going to likely force more nurses and frontline healthcare staff to go to the private system because they're simply not paid enough. And the working conditions are not good enough. And then that is going to make it even more challenging for the committed staff in this room who are operating our public hospitals. And Doug Ford calls this innovation. I call it destroying our public health care system. The very healthcare system our loved ones rely on. And so let's have a different vision. Let's have a vision where we invest in improving access to primary health care and team-based health care, including nurse practitioner-led primary health care teams. Investments to expand home and community care. Investments to increase access to non-profit long-term care and increase standards of care, including a minimum standard of care of 4 hours and better nurse-to-patient ratios. Let's make investments to declare the opioid epidemic as a public health emergency so we can direct the resources we need for harm reduction, safe supply, and treatment options. Let's make the investments to improve the pay and working conditions for nurses and frontline healthcare workers. And let's make our voices loud, because this government isn't listening, and we have to force them to listen, because that's what the people of Ontario need. We need this government to understand that the quality of patient care is directly related to how much we care for the people who care for our loved ones, the people in this room. So we are here as Greens to fight with you and alongside you, because we believe that every public dollar in the healthcare budget should be spent on healthcare, on patient care, on the people who care for those patients, not shareholder profits. And so our number one priority is to increase funding for a publicly funded, publicly delivered healthcare system that takes care of the workers who deliver the care in that system. That's why I'm so impressed and excited to work with you on addressing systemic barriers, on seizing opportunities in the nursing career pathways, especially for nurses from Black, Indigenous, and people of color communities. We need real action to retain staff and to recruit new staff and to ensure that foreign trained nurses can easily access nursing careers. And that starts with fair wages, fair benefits, and better working conditions. I want to close today by saying a special thank you to the RNAO for your tireless work to raise awareness and to advocate on the need to address the social and environmental determinants of health. Greens are here to work with you, and by the way, we just doubled our caucus, adding Ashlyn Clancy, a social worker, to our team. And we need a nurse now. We want to double again. I'd love to double with a couple nurses, so just let me know. Let me know. We've already got one lined up. Awesome. Oh, here's another one. Perfect. Because we want to work with you on the social and environmental determinants of health. We want to work with you to end legislative poverty by more than doubling social assistance rates. We want to work with you to end homelessness in our communities by once again having government invest in deeply affordable nonprofit, co-op, social, and permanent supportive housing. We want to work with you to end environmental racism. We want to work with you to protect our farmland and our local food supply chains and ensure that all people in our province, especially young people, have access to healthy local food. We want to work with you to reduce climate pollution and to protect us from extreme weather events like flooding, droughts, heat waves, and poor air quality from forest fires, because we know that all of these issues affect people's health and directly affect our healthcare system. So I want to thank RNAO for your tireless advocacy on these issues that sometimes people don't always think of as healthcare issues, but they are. I said thank you for that. So I cannot think of any better way to address the crisis in our healthcare system than to work with you, to learn from you, to follow the fantastic and amazing advice that you put forward in the many reports that RNAO produces, and to invest in nurses, the cornerstone, the backbone of our healthcare system. So I just want to say that during the pandemic, people called you heroes. And in my eyes, you've always been and will always be heroes. And I will continue to fight for a government that treats you as heroes. Thank you for having me here today.